Finally, my life is falling back into place. I left my abusive boyfriend over a year ago, and now I've found Martin. He makes me happy again. But just as we said goodbye to each other, I felt someone following me. I turned around and saw my ex-boyfriend. Within a second, he threw acid on me. The pain was unbearable. My skin was burning away. My whole life changed the night of my acid attack. I spent horrible months at hospital. Operation after operation, doctors tried to rebuild my face. It was no use. I couldn't eat, drink, or speak properly, and I didn't recognize myself in the mirror. I wouldn't ever go outside because people would give me awful looks, insult me, and even hide their children from me. I didn't even feel like a human anymore. Then one day, I was seen by a specialist surgeon who told me about the opportunity of having a face transplant.
Okay, Miss Brown. So, we're prepared to get you into a procedure called facial transplantation. You should know we don't usually consider this procedure unless it's necessary. So, all the patients that go through these procedures are selected on a case-by-case basis. And if any other conventional techniques are available, we would use those first. But in a case such as yours, I think this is our best options. So this is a multidisciplinary collaboration between many experts. And we will assess your psychological condition prior to this procedure, because we do have a number of cases where patients, after the procedure, experience certain difficulties, like feeling guilty of using other people's face, or simply just by adapting to their new appearances. So let me just give you a few details about the procedure you're going to go through. So first of all, we have to collect the tissues from the donor. So all the skins, bones, and blood vessels and nerves will be carefully dissected and preserved for as long as possible, since this procedure can take a very long time. And then we'll remove your scar tissues before we attach the blood vessels and the nerves, the muscles, and soft tissues and skin. So you should know there are still a few risks after the procedure. You will be given some immunosuppressant as a prevention for any rejection of the donor's organs, just like any other major transplantations. But that could lead to increased risks of cancer or infections or even diabetes, and your life expectancy will probably reduce, as well as the quality of your life. So if you're okay with this, you'll have to sign the consent form first.
I have my doubts concerning this surgery. Whose face will I get? A man or a woman's? Which skin colour and what age? At the moment I'm really unhappy, but will this surgery improve my condition? Will I be able to eat properly and without pain again? Or perhaps I won't be able to move any muscle in my face anymore because the nerves didn't regenerate. And once the procedure is done, it's done. Will I look like the donor afterwards? Transplanting a face doesn't mean that the other person looks exactly like the donor. The residual bony structure of the recipient gives the transplanted face a new and unique shape, so that the resulting appearance doesn't look like the recipient or the donor. Studies have shown that people have a significant improved quality of life after their face transplantation, including less pain and improved social reintegration. Moreover, they are much happier with their body image.
So if you would like to continue with this procedure, you'll have to sign the consent form here.